What is obesity? As per WHO, obesity is defined as an abnormal or excessive fat accumulation that presents a risk to health. Obesity is calculated by using body mass index, BMI, which takes into account both weight and height. A healthy BMI ranges from 18 to 24, while a BMI over 30 is considered obese. How does it occur? We eat food to gain energy. However, the amount of energy varies for every person, depending on the person's daily requirements. This energy is measured in terms of calories. There is a daily limit on calorie intake, which if exceeded, leads to obesity. In other words, when energy intake, the food and drink that we consume, exceeds the amount of energy expended, energy used for physical activity. If you take in more than you burn, then you gain weight. This leads to obesity. What are the causes? Some of the major causes of obesity are diet. The appetite for palatable, high-calorie food, especially fat, sugar, and certain animal proteins, is the primary factor driving obesity worldwide. The primary sources of these extra carbohydrates are sweetened beverages and potato chips. Genes. Although genes are not directly responsible for obesity, they may influence how we eat and exercise. Lifestyle. A sedentary lifestyle plays a significant role in obesity, as it offers little to no physical activity. This is primarily due to the increasing use of mechanized transportation and a rising prevalence of labor-saving technology for day-to-day activities. Sociological. The types of food and portion sizes available to you around your work and home might affect your diet choices. Metabolism. The efficiency of the body in turning food into energy can be a factor in determining the chances of obesity. Medical conditions that cause weight gain, such as hypothyroidism, depression, Cushing's syndrome, PCOD, and many more. Medications, such as antipsychotics, can cause weight gain as a side effect. What are the symptoms? Common symptoms of obesity in adults include excess body fat, particularly around the waist, shortness of breath, sweating more than usual, snoring, skin problems from moisture accumulating in the folds, inability to perform simple physical tasks. Fatigue can range from mild to extreme. Pain, especially in the back and joints. Psychological issues such as negative self-esteem, depression, shame, and social isolation. What are the complications? Obesity, if not taken care of, could result in various chronic diseases such as 1. Type 2 diabetes. Obesity can cause insulin resistance and increase the risk of developing type 2 diabetes. 2. Heart disease. There is a significant association between obesity and cardiovascular diseases. It can cause problems with heart rhythm. 3. Cancer. There are some links between diet and cancer, especially colon cancer. 4. Osteoarthritis. Obesity can lead to a category of chronic pain disorders known as osteoarthritis. It can also cause lower back problems and may increase the risk of knee arthritis. 5. Breathing problems. Obesity could lead to various breathing disorders, such as sleep apnea, which is a disease in which your throat closes during sleep. 6. Gallbladder disease. Obesity is linked with the development of gallstones, which are small stones that grow in the gallbladder. They can cause blockage of bile to flow into the intestine and may be painful. What is the treatment? A structured program is essential for successful long-term weight loss. The weight loss program must contain 3 essential components. 1. A nutritionally balanced diet. 2. Aerobic and strengthening exercise, and 3. A reduction in the percentage of calories derived from fat. Excess fat must be burned by increased physical activity, a change of lifestyle, and switching to healthier foods gradually. In cases of morbid obesity, surgical treatment is available too. Some effective tips for weight loss can be: avoid all diet fads and diet revolutions. Avoid anorexic drugs. Change the composition of the diet. Maintain carbohydrate and protein intake and decrease fat. Avoid simple sugars. Attend multiple office visits to establish a baseline and to motivate continual weight loss. Decrease calorie intake to approximately 500 kcal/day less than energy expenditure. This produces a weight loss of approximately 1 pound/week. Increase aerobic and strength training exercises. This is essential for long-term weight loss and maintenance. Receive positive reinforcement from a support group, the physician, family, and friends. Treat comorbid conditions, including depression. Consider carefully any weight loss pharmacotherapeutic agents or surgical procedures. Thank you for watching, and please subscribe or follow for more videos.